I'm Dave Jones, and joining me via phone here at WGRC, Dr. Daniel Laroche, Director of Glaucoma Services and President of Advanced Eyecare of New York, Board-Certified Associate Professor of Ophthalmology at New York Eye and Ear Infirmary of Mount Sinai. Dr. Laroche, thanks for being here. How you doing?
Thank you very much for having me. I'm doing great. Thank you.
Eye care, very important. I would assume most people probably take for granted that they wake up every morning, they can see, maybe need glasses, maybe not, but people take for granted they're just going to be able to see. And we know that there can be some serious eye disorders. We're going to talk about that here in a moment. But for those that may be unsure when it comes to eye doctors, share with us the difference between an optometrist and an ophthalmologist.
Yes, optometrists are able to examine eyes, prescribe glasses, perform medical eye examinations, and even prescribe some eye drops for treatments of various diseases, but they're not able to do surgery. Ophthalmologists have gone to medical school, so they're IMDs, and they're able to actually not only take care of eye diseases and manage eye diseases such as glaucoma, diabetic retinopathy, retinal detachment, but actually perform surgery to restore vision for cataract surgery, glaucoma surgery, retinal detachment surgery, things of that nature. And they have more years of training because they've gone to medical school, have done a residency, and sometimes a fellowship as well. So it's a more involved type of training for medical diseases of the eye.
Now, for regular care of the eyes, if you will, what is the recommended time frame for eye checkups, eye exams as people progress from, childhood, teenage, up through adulthood? What do you recommend?
Well, the American Academy of Ophthalmology recommends that everyone over 40 get an eye examination, annual eye examination. And it's important to check for one, to make sure you have the appropriate prescription for glasses. Over age 40, sometimes you can develop what's called presbyopia, where the lens of the eye doesn't focus as well, and you need glasses for reading. You'll notice that you'll be moving your hand away towards a distance to try to read something at times. And so that's the early onset of presbyopia, and getting the correct pair of glasses can reduce eye strain, headaches, and things of that nature. At the same time, they'll check your vision to make sure you don't have any cataracts, check your eye pressure to make sure you don't have glaucoma. That's a disease of the eye where the optic nerve becomes damaged, usually associated with elevated eye pressure that you cannot feel. So it's very important to get an eye check to check that eye pressure. The mean normal intraocular pressure is about 15 in the eye. When you get 18 or higher, you have to be possibly concerned about glaucoma. There are some exceptions to that. And if that's the case, they may need to do some additional testing, like a visual field test, an OCT test that looks at the thickness of the nerve inside the eye. Another thing you want to get checked for is retinopathy. We have an epidemic of obesity, diabetes, hypertension in America. That can cause various types of retinopathy that can cause bleeding in the back of the eye, strokes in the back of the eye. And so we can detect that early with a dilated retinal examination. And we have new treatments with anti-VEGF injection treatments, laser treatments that can help preserve vision. It's very important for people to take their own health in their hands by eating healthy. Lots of salads, lots of vegetables, baked chicken, baked fish. Drink lots of water. Stay away from too much rice, too much bread, too much sodas and juices. Exercise 30 minutes a day by walking. That helps to improve the blood flow and reduce your weight. And also meditation, 15 to 30 minutes a day. Deep breathing exercises that helps to lower eye pressure and blood pressure by about 20% to help maintain your health. And then the final thing to get checked for in your 70s, you can develop macular degeneration, which is abnormal blood vessels in the macula, which is a central part of your vision in your eye that can lead to decreased vision, central vision in particular. And we have special anti-VEGF injections we can treat that with as well to help preserve vision. So those are some of the leading causes of visual impairment currently in America.
And as you mentioned there, you gave some lifestyle habits that people can utilize, can practice to take care of their eyes and, possibly either prevent some of these conditions or at least minimize these conditions. Many, if not most of them, they are definitely treatable if caught early.
Absolutely. With glaucoma, for example, That's usually associated with increase in size of the lens of the eye that occurs with aging. And now we have new, safer surgical techniques for cataractic surgery and microinvasive glaucoma surgery, where we can prevent glaucoma, cure early glaucoma, and get people off of eye drops if the procedures are done early enough. So the earlier you do these techniques and have these procedures done, the better in terms of preserving your vision. So we've made tremendous strides over the last 20 years. So it's very important for people to get their medical checkup, check their blood pressure, the blood sugar, get their eyes checked, check your vision, check your eye pressure, and things of that nature.
Let's talk about the everyday care of the eyes. Here we are in the summer months, of course, hot temperatures, bright, sunny days. What are some things people can do to protect their eyes during the summer?
During the summer with sunlight, you want to wear sunglasses with UV protection because the sunlight rays, ultraviolet light, can increase the risk of cataract. So people who are working outdoors throughout the day, like our postmen, people walking around, farmers that are constantly outside, it's very important to wear UV protection to protect the eyes against sunlight to reduce the development of cataracts in that respect. So that's the big thing for the summer. Also, in the spring, sometimes you can get allergies and itching when the pollen season is out. People's eyes will become red and itching, so use warm compresses, keep the eyelashes clean. And we do have anti-allergy drops that can help with that as well. So those are the big two things in the summer that can come around.
Now, combating blindness is a big mission of what you do, and in fact, you've taken that a step further from just actually treating patients. You decided to come up with a song to help combat blindness and bring awareness to that. In fact, we are going to drop a link to our podcast to that song. Tell us, how did you come up with the idea to put this song together, and why did you do it?
Oh, yeah. So two of my patients were excellent musicians, and I really liked, they had sold me a CD, and I liked their music and the way they composed it. And I'd always had a thought in mind of doing a song to educate the community about cataract and glaucoma. A lot of times messages are transmitted through music, and so I thought it would be nice that a health message to educate the community about cataract and glaucoma could be made to share that message with the community and people in a social setting. And the mass could be a radio, or DJs could play at parties and things of that nature. So that's what we had in mind, and I collaborated with two of my patients on this. They were excellent musicians, and we were able to come up with a nice song that educates the community, has a nice Caribbean rhythm, and is catchy. And thank you for sharing it with your listeners.
Absolutely. I've already previewed it. It was definitely a catchy, fun song. Well, we typically don't think about our eyes until there is a problem, but doctor, as you have pointed out, some great eye care, some early detection of problems, and there is a great possibility that we can keep our eyes healthy throughout the entire lifespan.
Yes, indeed. Absolutely. We can really bend the curve of blindness from cataracts and glaucoma. We need to train more surgeons. We need to further educate the community as to what's available out there and to not be afraid to get your eyes checked.
Dr. Daniel Laroche, Director of Glaucoma Services and President of Advanced Eyecare of New York. Doctor, thank you so much for taking time here with us at WGRC.
Thank you so much.